Everyone, my name is Xantavia Fergus, and today I'll be presenting on the influence of technology on healthcare delivery and administration. The purpose of this presentation is to walk you through how technology is transforming both the patient experience and the administrative side of healthcare. I'll be talking about what's improving, what's becoming more challenging, and why these changes matter. Technology isn't just something healthcare uses, it's something that has completely reshaped the system. So, throughout this presentation, I'll be giving examples, explaining the impact, and looking at the bigger picture of how technology affects everyday healthcare. Let's start by looking at how healthcare has changed overall and the role technology plays in that shift. Healthcare healthcare today looks very different compared to even 10 or 15 years ago. Before, most care required in-person visits, paper charts, and slower communication between providers. Now, digital tools have created faster, more connected, and more integrated health care systems. For example, telehealth allows appointments from home. Electronic health records make patient information accessible in seconds. Auto official intelligence help analyze medical images and predict health risks. Wearable devices give patients real time feedback about their own health. These tools help improve access, make care more consistent, and reduce mistakes. But they also bring challenges such as privacy concerns, unequal access to technology, and the need for constant training. With that in mind, let's start with one of the most visible technologies in healthcare today, telehealth or virtual care. Telehealth became extremely important during the COVID-19 pandemic when patients couldn't safely visit clinics or hospitals, which is what is interesting is that telehealth didn't disappear after the pandemic. It continued to grow. Many providers realized that virtual care actually solves long-standing access problems. Telehealth is especially helpful for patients living in areas, people who don't have reliable transportation, parents who can't always leave work or find childcare, people with chronic conditions who need frequent check-ins, and individuals with mobility challenges. Telehealth also um, providers access to real-time data. For example, a patient monitoring their blood pressure at home can send results immediately to the provider instead of having to wait months for an in-person visit. Now we're going to talk about the benefits of telehealth. Telehealth makes care more convenient and accessible. Patients avoid travel, which saves gas, money, time off work, and stress. For rural communities where hospitals may be 30 to 60 minutes away, telehealth can be life saving. Telehealth also reduces unnecessary ER visits. For example, patients with mild symptoms or medication questions can connect virtually instead of going to the ER. This keeps the emergency departments open for true emergencies and reducing overcrowding. Another major benefit is better disease management. Remote monitoring tools such as blood glucose sensors, digital scales, and wearable heart monitors send information directly to providers, which can help catch issues early rather than waiting until symptoms worsen. Even though telehealth brings a lot of benefits, it also comes with some challenges. So here are some challenges of telehealth. One of the biggest challenges is the digital divide. Not everyone has a smartphone, a computer, or a strong internet connection. This is especially true for older adults or low income families. Privacy and security also create concerns. Anytime a medical visit happens online, there's always the risk of hacking or unauthorized access. Healthcare organizations must follow strict rules to keep patient information safe. Telehealth has clinical limitations also. Some conditions require hands-on exams, imaging, or lab work. So no matter how advanced virtual care becomes, certain health needs will always require an in-person visit. And finally, clinics and hospitals must train their staff to use telehealth software. Providers need to know how to troubleshoot audio issues, share screens, and manage digital documentation during virtual appointments. Telehealth is just one part of digital healthcare, though. So let's explore some other tools that's shaping modern healthcare, like digital health solutions. Digital health includes everything from electronic health records to artificial intelligence to patient portals. Electronic health records, EHRs, allow providers to pull up patients' full medical history instantly. This reduces mistakes, avoid duplicate tests, and improves communication among specialists. AI supports diagnosis, predicts health risks, helps identify patterns, and can quickly analyze huge amounts of data that humans simply can't process in the same time frame. Patient portals give individuals more control over their health by letting them access results, schedule appointments, request refills, and message providers. These tools help both the clinical and administrative side of healthcare, but they also require ongoing investment in cybersecurity, software updates, and staff training. Since patient portal affect day-to-day care for so many people, let's look at them more closely. Patient portals help bridge the communication gap between patients and providers. Instead of waiting days for a phone call, patients see lab results within hours. They can double check medication instructions or message their care team with questions. Now, with that, I would say an issue, you know how even with the phone call they have what 24 to 72 hours or 48 to 72 hours to respond from your phone call. It's the same way with um messaging them online. Sometimes they get back to you right away, other time you're in that 48 to 72 hour window. But anyways, like I was saying, not everybody finds the portals easy to use. Some people struggle with remembering their passwords or navigating the systems. Others may not even have a device at all to even access their portal. So for the patients who do use them, portals do offer a sense of control. They support shared decision making and help patients feel more connected to their healthcare team. Okay, we're going to take a dive into the administrative side of healthcare, which is just as important as the technological digital side. In healthcare administration, in the technology, behind the scenes, this technology helps administrators manage scheduling, billing, insurance claims, staffing, documentation, and compliance. These tasks used to require hours of paperwork and manual tracking, but now tools can automate much of the process. For example, scheduling systems automatically match patients with available providers. Billing software checks for errors before claims are sent. and digital documentation reduces the chances of losing the patient files. Technology also supports communication between departments. A doctor, a lab tech, a business specialist can all access the same patient record in real time. So one of the most administrative tools is the electronic health record system. So let's talk about that a little bit. EHRs keep patient information centralized, organized, and accessible. Providers can quickly review a patient's medications, allergies, and past diagnosis before making treatment decisions. EHRs also improve safety by reducing duplicate tests and preventing medication errors. So if a patient has multiple visits or a patient visits multiple providers, each one will see the same information, which will help with the care coordination because they don't have to call, doctor's office or previous doctor's office to try to get this information. It's all right there in the one system. A downside, EHRs can be expensive to implement. The requirements of preparation, training, and data migration. And even after implementation, staff must continue learning updates and upgrades. But overall, EHRs have become essential for consistency, safety, and communication in healthcare. Another major technology that supports administrators is data analytics. And data analytics allows organizations to make data-driven decisions instead of guessing. For example, analytics can show patterns such as when clinics are busiest, which services are most commonly used, what conditions different populations struggle with, how many staff members are needed at certain times. It can also help with budgeting, forecasting, identifying gaps in care. It allows organizations to plan ahead and improve efficiency. But the analytics rely on accurate data and training personnel. So if the data entered into the system is incomplete or incorrect, the predictions may also be inaccurate. So technology continues to reshape healthcare in major ways. It improves access, communication, safety, and overall patient outcomes. Again, tools like telehealth, EHRs, AI, and digital portals make healthcare more flexible and connected. On the admin side, technology improves workflow, planning, and coordination, making it easier for organizations to deliver care efficiently. Even though challenges like cost, cybersecurity, equity, and digital literacy still exist, the overall direction of healthcare is moving forward toward a more connected, data-driven, and patient-centered future. By investing in training, planning, and secure systems, healthcare organizations can make technology work for both patients and staff. Just gotta stay invested. Thank you all for watching and listening to my presentation. Hope you enjoyed.